Data and research play major roles in all sectors of the economy, including health, where experts believe will enhance easy health indices to tackle the challenges in the health sector.
Use available information to guide day-to-day decision making, both at the facility level and above the facility level.
To this effect, the Edo State government says it is committed at all levels of the health system in providing effective leadership and governance in matters relating to the health information system. The core principle is managing and coordinating the availability, consistency, and utilization of collected data.
Each time they present data to me, I've always have cause to question some of the figures that are there. Because, like I said, it needs to be improved upon. I'm quite happy that at the end of the day, even the USAID are also interested. The quality of data that we collect can be very much improved on, and I think that's what this gathering is all about, so that the data we get from this state can be much reliable than what we are currently having.
Now that the governor too is very passionate about data, before he gives you anything, or before you say anything, he wants it, is it evidence-based? Let me look at data. Like in the Edo Health Insurance Program, when we went for our facility studies, and we saw all the things that were in the facility that was not, in place. With our data information, he was convinced. And for the first time, immediately he said, okay, you do 20 primary health care renovation. Because when you have data and you don't use it, you don't disseminate, it's like as useless as tissue paper.
With accountability as a key contributor to improving health system performance, key players at the newly inaugurated Health Data Governance Committee meeting in Benin City were unanimous in agreement that health data is a strategic asset.
So essentially what we are here to do is to brainstorm on the already identified gaps and challenges in the health data system in Edo State. So we want to know why our data is missing, and we want to know what we can do with regards to improving data gathering and collection in Edo State. Data is very important because we know that we use it for planning and implementation of programs. We also use it to even attract the donor funds. We use it for accountability. So essentially, data is central to almost everything we do in the health sector.
According to the national guidelines, is domiciled within the confines of the state ministry and possible beyond. And we are hoping, given current resource constraints, that this forum can be harnessed properly using a targeted and contextualized approach to ensure that data generated at the health facility or from the health facility are used at all tiers of government for effective decision making. The entire spectrum of data management. We talk about from the collection point, that is service delivery point at the health facility level, then the collation, then the analysis, then the archival or storage, then the dissemination to policymakers and other key stakeholders, that we utilize this same data for effective decision making to improve the efficiency and quality of health outcomes in the state.
With support from partners like USAID and WHO, the objectives of the meeting will reignite various roles in the generation of data. Osiyuko Mesado, AIT News, Benin, South Nigeria.